Here's a health alert that could change how you manage pain for the rest of your life. The NHS has issued a stark warning about ibuprofen. Yes, that common over-the-counter painkiller you've probably used for everything from headaches to sprained ankles. But here's where it gets controversial. Not everyone who needs it can safely take it. And this is the part most people miss. Even if you're in a high-risk group, the consequences of misuse could be far more severe than just a stomachache. Let's break down the full story, from who should avoid ibuprofen to the hidden dangers hiding in plain sight. And before you dismiss this as another health scare, consider this. The NHS isn't just being cautious. They're outlining a roadmap to avoid life-threatening complications. So are you in one of the vulnerable groups? Let's find out. Who should avoid ibuprofen? The NHS has drawn a clear line in the sand for specific populations. If you fall into any of these categories, ibuprofen could do more harm than good. For starters, if you've ever had an allergic reaction to NSAIDs, like aspirin or naproxen, even a mild one like a runny nose or wheezing, this medication is off limits. Pregnant individuals are also explicitly warned to steer clear, as it can pose risks to both mother and baby. But here's the tricky part. Even if you're not pregnant, other conditions like heart failure, severe kidney disease, or uncontrolled high blood pressure make ibuprofen a dangerous gamble. Let's dig deeper into the list of red flags. 1. A history of stomach bleeding or ulcers caused by NSAIDs. 2. Chronic stomach issues like Crohn's or colitis. 3. Asthma, hay fever, or severe allergies. 4. Liver or kidney disease, even mild forms. 5. A recent chickenpox infection. Ibuprofen may worsen complications. And this is where most people overlook a critical detail. Seniors over 65 face a heightened risk of stomach ulcers. If you're in this age group and need long-term pain management, your doctor might prescribe a protective medication to counteract the damage. Recognizing serious side effects. You've probably heard of common side effects like indigestion or dizziness, but the NHS is urging everyone to pay attention to the red flags. For instance, black stools or blood in vomit are not just unpleasant. They're emergency signals for internal bleeding. Similarly, swollen ankles or changes in urination could indicate kidney trouble. But what about the rare but deadly reactions? The NHS warns of anaphylaxis, a severe allergic response that can shut down your airways. If you notice sudden swelling of the throat, lips, or tongue, or if you're gasping for breath, you're not just having a bad day. You're in a medical emergency. And here's a chilling twist. Even people with no prior history of allergies can experience this. When to seek immediate help. The NHS isn't exaggerating when they say some symptoms demand a trip to AE. If you're experiencing severe chest or stomach pain, it could signal a stomach perforation. Difficulty breathing or worsening asthma symptoms are also non-negotiable red flags. And let's not forget the neurological warnings. A stiff neck, sensitivity to light, or hallucinations could point to meningitis, a condition that needs urgent treatment. Who gets to decide? This brings us to a provocative question. Should ibuprofen still be freely available over the counter given its risks? Critics argue that while it's effective, its accessibility often leads to misuse, especially in vulnerable groups. Supporters counter that banning it would leave millions without affordable pain relief. Where do you stand? Should stricter regulations apply to NSAIDs, or is the onus on individuals to read the labels carefully? In the end, the NHS's message is clear. Ibuprofen isn't a one-size-fits-all solution. Before reaching for that bottle, ask yourself, are you in a high-risk group? Could your long-term use lead to complications? And most importantly, are you aware of the symptoms that demand immediate action? Share your thoughts in the comments. Let's start a conversation that could save lives.